Does your furry friend take over your bed every night? It's time to reclaim your space while giving them the comfort they deserve with the coldest, cozy dog bed. Don't wait. Check out the link in the video description to buy now on Amazon.
Jacinta Allan's government has been slammed for encouraging biological males who identify as females to participate in a women's pain inquiry. Anyone who identifies as a woman has been urged to take part in the taxpayer-funded investigation that is looking into women's issues such as endometriosis, fibroids, polycystic ovary syndrome and menopause. The Department of Health website asked for individuals, clinicians, and organizations to share their experiences and knowledge on women's and girls' pain, care, service and treatment in the state's health system. The inquiry will report on these experiences and make recommendations that will form the basis for improved patient care, the page read. Women's advocates said asking those who may have a different sex at birth to make a written submission is absurd and making a mockery of women's pain. Women's Forum Australia Chief Executive Rachel Wong said women are understandably angry by the move to include biological men. It is physiologically impossible for men to experience female health conditions or the pain that comes with them, she told the Herald Sun. A well-known Victorian surgeon criticized the initiative, saying gender-affirming care was creating havoc in healthcare and that biology needs to be put before identity. The doctor explained that medical professionals who criticize the system can face disciplinary action or even deregistration. Ms. Allan launched the inquiry into women's pain in January, with the investigation part of a $153 million women's health transformation project. Many women in our community know that there is a gendered pain gap, she said at the time. They know that their pain is real and they also know that for too long, that pain hasn't both been believed and received the treatment it needs and deserves through our health system. That is why the government is placing a significant amount of attention and resources on this issue. Because when we support women's health, we support the health of all Victorians. The decision to incorporate transgender individuals into the inquiry followed public criticism of the government for perceived exclusivity in its women's health survey last year. A Victorian government spokesman said they will ensure each submission and recommendations is taken seriously. Opposition health spokeswoman Georgie Crozier acknowledged the sensitivity of the issue, but said the inquiry needs to stick to the issue it is supposedly inquiring into. According to the Victorian government, approximately 200,000 women statewide suffer from endometriosis, and on average it takes 7 years to receive a diagnosis. Around 40% of Victorian women live with chronic pain and 1/3 are affected by debilitating menopause symptoms. Submissions close on July 31. Daily Mail Australia contacted the Victorian government for comment.